All right, so we have a patient who comes in with lateral foot pain. We have multiple etiologies behind a foot pain. However, one of those, the most common, is going to be an inversion ankle sprain. And its little sister is going to be a cuboid joint dysfunction. 5% of people with inversion ankle sprains actually get an issue with the cuboid. Now, that's due to an injury. You can also have repetitive stress to the cuboid. That's more of our runners who are running on the outside lateral column of the foot. If we have a patient with cuboid dysfunction, there are a couple things we can do to help this patient. I'm going to show you 3. The first is going to be a cuboid squeeze. Now, I love manipulation. I love hearing joint sounds. However, when we do the cuboid manipulation, we have to place the foot in excessive plantar flexion and inversion, which is exactly how they injured in the first place. So the cuboid squeeze is a very gentle kind of mobilization. It's going to help those kind of patients as compared to the whip mobilization. So let's first show the cuboid squeeze. With the cuboid squeeze, we really want the patient nice and relaxed. So they're in about 60 degrees of knee flexion. I'm going to take a gentle contact right over the cuboid, so just distal to the calcaneus, right before the 5th metatarsal. I'm going to use both thumbs and nice and relax, and you can use some vibration to get them to relax. And all I'm going to do is bring them down into plantar flexion, and I'm going to go into some inversion, and now like a grade 3 mobilization and forcing that cuboid back up. I'm going to do about 3 sets of 10 repetitions of those with my patients. Now, if the patient is able to tolerate the cuboid whip, the cuboid manipulation is the exact same position. However, now I'm going to do the exact same thing, inversion, plantar flexion, and at the very end, I can create an impulse going down into that same direction. Historically, it's also been done without the thumbs, with more of a piezoform contact, so you can support the lateral column and lateral malleolus, and you can take your piezoform contact right over that cuboid, and now it's going to be the exact same mobilization, and now you can actually use a little more force to get that manipulation of the cuboid. Now, there's a lot of people who will also do this standing. When we do the standing manipulation, I do like this because they tend to be a little more relaxed. And now I can do the exact same contact on the cuboid, once again going lateral with the foot in plantar flexion and inversion, and now forcing it into motion there. Thank you very much. So whenever you have a patient with lateral foot pain, check out all the joints in the foot, especially the cuboid. It's very easy to address as far as manipulation, and if you suspect they're not able to tolerate manipulation, that's when you use the cuboid squeeze.